Hello and welcome to this video. Today I'm going to be talking about how to engage with clinical preceptors and superiors. This is a very difficult moment when you're going out there in the clinical realm and starting to engage with practicing the theories that you learned in the classroom or the different things that you worked on in the classroom to sort of make a manifestation to an actual patient care, not a mannequin or each other in the classroom. So when we're looking at this, it's important that we look at things like how to interact with respiratory therapy, with nursing, with all of medicine together. You're going to be interacting with different groups, not just respiratory therapists. When we're looking at this, our clinical education really does serve a bridge between the theoretical knowledge and practical application. And it's these relationships between students and preceptors that really will play a role in the success of the learning process. So how do you approach this relationship? How do you approach discussing with the preceptor the things or asking the preceptor different things? Preceptors, when we're looking at these, they help guide us students in clinical tasks, but they are also mentors and they're evaluators. They're helping to see how are you doing with the current practice that's out there. They help shape the professional skills and the attitudes of how we're going to practice. So I'm going to look at strategies for engaging with clinical preceptors appropriately. And I'm going to give you some sample questions, some interactive discussion scenarios, some tools to help you in developing your communication skills with this complicated relationship. So the first one that I want to talk about is just give you a little taste of what you're looking at here. All right. Sample situation, feel free to pause the video and think about how you would respond to this. You have just finished performing a respiratory assessment on a patient and you ask your preceptor for feedback, and the preceptor points out to you that you missed a critical sign of respiratory distress. How are you going to respond? All right, pause. Think about how would you respond? How will you respond when this happens? No one's going to go out there and be perfect as a student. So pause. Unpause it when you're done. All right, hopefully you got a good answer in your brain, and if you're thinking, wow, I had no clue how I would respond to that in an appropriate way, a respectful way, then this is the lecture for you. All right, here's another scenario. During rounds, you notice a difference in the treatment plan for what you were taught in the class, and you want to understand the reasoning behind this preceptor's decision to change what you were taught in school. How are you going to ask this question? How are you going to form it in a way that's respectful, in a way that helps them? So pause and think about this. All right, so hopefully you're thinking to myself, yeah, it would be great to sort of understand what's the best way to respond to situations like this, and that's what we're going to unpack here. So pay attention. I'm going to give you some helpful tips on how to unpack that clinical relationship. All right, so what roles do preceptors play? Well, this is important for you to see. A preceptor has multiple roles. They're a teacher, they are a mentor, and then they are also your supervisor. As a teacher, the preceptor really helps the student apply theoretical knowledge. So they're there to help you connect what you learned in the classroom to what you're seeing with patient care. So you're seeing the real world clinical situations that you were taught in the school. As a mentor, they really do provide guidance on professional behaviors and ethics. And this is something important to notice. Don't just notice how they practice, but also think about how are they behaving professionally? How are they behaving with their ethics? These are models that you can look at as well. And then finally, as a supervisor, they assess your performance. They're going to provide you feedback for improvement. So when you see this, they need to give you that feedback, and you need to seek out that feedback. And that's important for you to understand and what you need to grow in. So it's essential that you see that these three roles of what they're doing is a part of what you're going to expect of them. You expect of them to be teaching you things. You expect of them to be a mentor. You expect of them to be your supervisor. So how are you going to respond to this preceptor? Respond to them as you respectfully would a teacher, as you respectfully would a mentor, as you respectfully would a supervisor. They are not your co-staff. They are your teacher, your mentor, your supervisor. That is a different relationship. So think about these things as you go through this. Professionalism. This is a key way to help make sure everything is going to go well in your clinical realm. Not everything perfect. I said everything well. But this is a key thing when you're interacting with preceptors and supervisors that are out there. This includes being punctual, showing up on time, wearing clothes that aren't wrinkled, and make sure your hair doesn't look like it's all over the place, making sure you're dressed respectfully, that you're communicating respectfully, you're not using unique language that shouldn't be used in front of children and families. When you approach the clinical experience with a commitment to learning and a positive attitude, they see someone that's a good potential candidate to be working there, someone that's a good potential candidate to be working with. Do you think they would like it if you showed up late to help relieve them from a shift? Do you think they would like it if you had someone show up to your hospital room wearing wrinkled scrubs and someone that really wasn't asking questions when things were difficult? So that positive attitude, that learning experience is going to be a big thing. So you need to demonstrate initiative by asking questions, by seeking feedback. These two things really show the preceptor that you're engaged and you're invested in learning. So be invested in learning as you're going out there. This is your learning experience. This isn't you just working for free. This is you learning and growing through this experience. So that professionalism involves respecting the preceptor's time and responsibilities as well. So make sure that your questions or your concerns about a situation or care plan are raised at appropriate times. Sometimes it's waiting till after the therapy is done, when you're in the department or when you're in a hallway, when you're somewhere else, when there's time for those questions. And make sure you're going to ask the questions that give you the most return of investment. And I'll talk about that in a little bit here, but make sure you have questions that are really going to help enlighten what's going on and really show the preceptor that you have good critical thinking skills. Strong communication is a key to being successful in life, not just in the clinical realm. So this is the heart of a successful student-preceptor relationship. You, as the students, really need to focus on being clear. You need to be focused on being concise. You need to be focused on being respectful when you're discussing patient care or asking for feedback. This is your side of things. Your side of things is to be clear, concise, and respectful. Not to talk their head off, not to, right, you can still ask questions, but you're here to be a part of that community, and that communication is where it starts. So it's important to use appropriate medical terminology while you're ensuring that the questions are well thought out. For an example, instead of asking a general question to the preceptor like, what should I do next? You should ask, given the patient's current status, should increasing the oxygen flow rate be an appropriate next step? This shows that you're thinking critically and you have a deeper understanding of the clinical situation. So think about the type of question you want to ask and what the question really says about you. I'm not saying to overthink it, but that critical thinking question, instead of asking, what do I do next? They're going to think this person doesn't know what to do next. Instead of you knowing what to do next, they don't know that you know what to do next. So right now, think about, how do I ask this question in a way that shows I'm critically thinking about this? Right? So would increasing this be the next step? Would doing this be the next step? Would changing this be the next step? Those are the things to really focus on, to ask those questions in a way that's not only efficient, but in a way that also shows that you're thinking critically, and that is a very good impression to make. So what are some sample questions? I hope you like the picture. What are some sample questions to really encourage discussion and reflections when you're in this preceptor-student relationship? Can you explain the rationale behind choosing this treatment for the patient? That's an interesting. I'm curious what their goals are. Like, those type of questions are great ones to ask. How do you approach a difficult patient conversations? Little things like, hey, what's the toughest conversation you've had with family or with coworkers or things like that? Little things like that could be a way to start off a conversation, or a way to start a conversation that helps you get outside of what's going on. Are there any resources you recommend to review to better understand what's going on, whether it's a disease condition a patient has, or let's say it's a mode of ventilation, or let's say it's something else? Is there any resources that were helpful to you to understand this? Can you provide some feedback on my technique? You do an ABG, you do a gas, you do a PFT, you do, name the procedure. Is there any feedback you have for me on that? Can you give me some feedback on my technique? Is there any times where you had to change your technique to really accommodate for a situation? What areas should I really focus on improving? If you're seeking that feedback of focusing on improving, then that gives them the idea this student really wants to learn. They really want to grow. They really want to be a part of this community. They're not just fixed on them being them. So this is a good sign to the preceptor. Last one I have here, what factors are you consider when you're prioritizing patient care in a fast-paced environment? In other words, when times are tough and you have to go from patient to patient to patient, how do you prioritize which patients you see first? How do you prioritize that? These are things that are great questions to ask preceptors in the appropriate time. So read the situation. If they're looking all grumpy and they haven't had their coffee yet, these questions may need to wait for a little bit later. One of the most valuable aspects of working with clinical preceptors is getting the feedback on your performance. So this is an important part. If you're not getting feedback each day that you're with a preceptor, then you're losing, because these are the people that are out there that are practicing. You're losing that experience that they have, that they can invest into you. So this can make you feel anxious. It's not always fun hearing the things that you're not great at, but that anxiety is just going to be there, but you got to calm yourself and realize this is something that's going to make me better. So to make the most of feedback, you should adopt this growth-based mindset, understanding there is so much to learn. Not how much you've worked hard to learn so far, and you've worked hard to get to this point, to get to clinical rotation, but understand that there's still so much more to learn. Even as a registered therapist, when you're out there, there's still so much more out there to learn. So understand that this is constructive criticism. This is intended to help you improve. So actively seek the feedback. Don't wait for it. Don't just wait and be like, well, they didn't say anything that I needed. Well, ask them, what are 2 things that I should work on with seeing me today? What are 3 things I should work on with seeing me today, right? These are some things that are very good signs for the preceptor, and are very good things for you, because then now you have that feedback to grow. And it helps you become more of a receptive and reflective learner as well. When you can reflect on yourself and learn, this is something that you want to keep as a habit when you're out there practicing. Man, what are some things that I should look up now? What are some things I've seen today that I really should go back and look up? What are some things I can get better at? And you're going to be that much better day after day after day when you practice out there. So start now. Start now having this reflective moment. So one of the things that you can do to help is to summarize key points, and ask for follow-up questions when they give you this feedback. So when they say that you really should work on your patient assessment skills, or that you should really work on interacting with patients, then summarize those, repeat those back to them. Yes, I really do want to work on these things. And then ask follow-up questions like, can you suggest a specific way I can improve my communication with my patients during assessments? And so then you can get that specific feedback to help you, instead of just vague general feedback. You can ask that follow-up and then get even more quality information from that interaction. All right, difficult conversations. At times, you might need to engage in a challenging conversation with a preceptor. So what if you do get a low evaluation score? Doesn't feel good, right? And maybe you misunderstood something, or they misunderstood something. In these situations, you need to, first of all, remember this: remain calm. It's going to be hard. You're going to have emotions that are running, which is humanity, right? That's us. But first things first, remain calm. When you're out there in the clinical room as a respiratory therapist, what's your first thing when emotions get high? Remain calm. Get your bearings under you. And then you can focus on being a professional and understand that this probably isn't an attack on you and your personality. This probably is just them giving feedback in a way that could have been worded differently, maybe. Right? So you need to be as professional as possible, and you need to be solution focused. All right, what's the solution for this? You gave me these scores. These aren't the scores that I was hoping for, right? These are the scores that I was hoping to do better, but what solutions do you have? What recommendations do you have? Stay solution focused. So approach this conversation by expressing a willingness to learn. Hey, I'm here to learn. I'm glad that you gave me these scores because now I can ask you specifically, what can I do? How can I interact differently? How can I improve here? So instead of saying, I don't think my evaluation was fair, how do you think that's going to come across? Yeah, I don't think you were fair to me. Is that going to be a very peaceful, calm resolution, or is that going to make for a very awkward moment? So here's what I would think that you should probably say instead. Try this out. I noticed that my evaluation showed areas of improvement in patient communication. And leave it out there, right? Leave it as an open-ended thing and see what they have to say. Maybe they're going to inject that there, but now it's an open, unawkward conversation, and now you're learning from this. Because remember, do you know everything there is to know right now? No. Do they know that everything there's to know? No, but what they do know is they see that this is an area for you to grow in, and this is your chance to get that feedback to grow in this area. So don't say, hey, I don't think you were fair to me. Say, I noticed that my evaluation showed that I have some room to grow here. What suggestions do you have? What can I do? What resources did you look at when you were trying to grow in these areas? So can you help me understand where I might have missed the mark or how I can work on this? I'll repeat that again. Can you help me understand where I might have missed the mark or how I can work on this? Notice how that doesn't put the preceptor in a defensive situation, and that actually helps you because now they're going to give you that constructive feedback. They're going to show you specifically or tell you specifically what they've seen and why they've seen it. All right, now I'm going to go back to these scenarios that were previously in here. So here's the scenario one. You have just finished performing a respiratory assessment on a patient, and you ask your preceptor for feedback, and they point out that you missed a critical sign of respiratory distress. How should you respond here? Right, this is the question we started off with on the very first slide. All right, so pause and think about how you should respond. Go. All right, hopefully you paused there and thought about how you should respond. Now, going through this, here's my suggestion. I would say something to the effect of, thank you for pointing that out. Could you help me better understand what I missed and how I can recognize it next time? Well, then the preceptor might say something like this. You missed the patients using accessory muscles while they were breathing. This is an important sign of respiratory distress, especially in patients with COPD. So next time, pay attention to the neck and shoulder muscles when the patient's breathing in. Well, how are you going to respond there? Well, yeah, that makes sense. I'll make sure to check for that sign during my future assessments. Are there other key indicators that I should watch out for patients with COPD? Do you guys see a difference here? Right, you learned through responding in a different way instead of getting defensive and be like, oh, they're attacking me. No, they're not attacking you. They're saying, hey, you missed something. And it's a very vulnerable, humbling experience when they do that. But I want you to respond in a respectful way, and that's the sample that I gave you here. In this sample, this is an interaction shows that you can engage in feedback positively and use it to improve your clinical practice. So hopefully this was a little helpful. Let's do another one. All right. During rounds, you notice a difference in the treatment plan from what you were taught in class. And you want to understand the reason behind the preceptor's decision to do this differently than what you learn. So how are you going to ask this question? So pause here and discuss. Maybe you have a better idea now, and go. All right, so hopefully you had a chance to like pause and think about how you were able to respond there. Here's a suggestion for me. Hey, I notice that we're treating this patient with a non-invasive ventilator, but in class we learned that we should intubate this patient for severe respiratory failure. Could you explain the rationale behind this approach, the strategy, the idea behind this approach that you guys are doing? Well, then that opens the preceptor up, and might be what the preceptor might respond with. That's a great observation. In this case, the patient's condition was stabilized without intubating him, and we wanted to avoid a lot of the risks with invasive ventilation, like infection. So non-invasive ventilation is often a preferred way to improve the patient outcomes before we would go to invasive ventilation. So now, from this interaction, you've learned why they didn't just go to intubation. Why didn't they just jump to that? Hey, now you understand the rationale and what you might see when you go out there to practice as a therapist yourself. So how would you respond here? Hey, thank you for clarifying. It's very helpful to see how treatment plans can vary based upon the patient's individual needs. So when you're looking at this situation, how you responded here, it really does demonstrate how you can ask insightful questions that encourage meaningful discussions without challenging their authority, right? And once you challenge their authority, once you challenge their thought process, once you challenge their critical thinking skills, how well do you think that preceptor-student relationship is going to go? Yeah, you do the math on that one. All right, time management's a big thing as a student going out there. Preceptors, they have a busy schedule, and students, well, we need to be mindful when we're seeking guidance or feedback from these preceptors. So one of the things that you should think about here is prioritizing your questions or your discussions. So first things first, think about before you're starting a discussion or starting questions with them, especially if time's short and you're running from patient to patient to patient. Think about the critical learning moments that you're seeing rather than overwhelming the preceptor with non-essential inquiries. So think about this as if there's something that I can really look up and grow more in this disease process, and this is something I can look up, something I can go back to my notes from class, then that's something that maybe is not a high priority question to ask the preceptor. But if it's something that is essential, something that shows that you're learning, then that's something that can really be helpful, and I would prioritize that question. So one of the things that I did here, and I put it in here, is to keep a notebook for your clinical questions and observations, because odds are you're going to forget to look you're going to have a question and you're going to forget it like 10 minutes later, or even less than that sometimes. So have a little miniature notebook, write it down, and then you can always go look it up later. And these are things you can go look up and ask them about during a break, or you can go look up and ask up after the shift is over, or things to ask your teachers, right? So these are observations and things like that that can be really helpful to you. And then you know that, okay, this one is more than a notebook moment. I want to see how they were thinking through this. I want to see why, just like what we were talking about that scenario with non-invasive ventilation a minute ago, why they chose to do those things. So choose an appropriate time after rounds are over, or during a debrief after a code. Not during a code, but after a code, or anything like that to really bring up your concerns or your questions. And then prioritize. Like I said, prioritize your questions that really help you understand what's going on versus questions that are easier to look up. Like, I wonder what the dose for this is. I wonder what so on and so forth. So prioritize your questions. Keep that little handy notebook. Write down fun stuff in it that you really want to ask yourself or ask someone else later. If you have time for it later, great. But your other thing would be observations, right? And that's a good way to see, hey, what are the 3 things that I've learned today? When you do your analysis at the end of the day, and when you're about ready to go home, what are 3 things I learned today? And one of the things I would also do when I was a student out there is I would always ask the preceptor, hey, what are your goals for today? What are your things there? And then I started that when I was a precepting student. I would precept and I would ask the student, hey, what are your goals today? What do you really want to work on? Do you want to work on looking at x-rays? Do you want to look at interpreting labs? Do you want to look at your patient assessment skills? Do you want to look at what do you want to work on today? And so think about your goals as a student each day. What are your goals? What are the things you want to work on? And I always knew if I had a student that had an answer right away to what are your goals, then this was a good student. This was someone that knew where they were at, knew what they wanted to learn, knew areas that they needed to grow in. And so start thinking about those. What are some goals for you when you're going out to the clinicals? And these are some things to start working on. All right, what about team discussions? All right, so you're going to have the opportunity to participate in team discussions, or if there's multidisciplinary rounds, if you get the opportunity to go to those, go. So ask relevant questions. If you're being a part of this discussion, ask some relevant questions. Make sure the question relates to this patient in this scenario. Hey, I noticed that this was going on. Share observations that really enhance the learning experience. Hey, I noticed that their lung compliance was low. I noticed that it was a lot of pressure to deliver the breath, but their abdomen also seems very tight. Is this playing a factor, right? So all these things will enhance your learning experience. But make sure that you're also being an active listener. This isn't your discussion. This isn't your show. This is you being a part of this discussion, not the primary part, but a part of this discussion. So it's crucial that you listen actively and make sure you respect the hierarchy of the healthcare team. Make sure that you only contribute when it's appropriate. So read the situation. Is it appropriate for me to pipe up and ask a question here? Sometimes you're going to see that it is, and other times not so much, especially if there's difficult things going on. So just defer to the expertise of the preceptor and the senior staff. You can always ask your preceptor, is this an appropriate time to ask a question, or do you want me to write it down and ask it later? So these discussions doesn't mean you can't participate in these discussions, but when you do, read the room, pick it wisely, make sure you understand that you're contributing to that team, and then sometimes maybe it's time to just write some stuff down and ask them at a different moment when they're more free or when the moment's less tense. All right, this is a big one. Emotional intelligence is a life skill, something all of us need to work on. This is a critical thing for healthcare because who are we working on? Other humans. And this allows us to navigate interpersonal relationships and respond to emotions of both the patients, but also each other, other nurses and doctors, and so on and so forth. So students that really engage with preceptors by demonstrating empathy and being self-aware, they really have and show the social skills that they can build strong connections, and then that's going to help support their learning. So the more you're sort of seeing what's going on, the better environment you're creating. So let me give you an example. If you're like, Derek, I did not understand anything you just said. I was distracted by something else. Understandable. But let me give you an example. You have a preceptor that has a lot of pressure. They're under time constraints. They have other patients they're yelling. They have a bunch of new orders that are coming across. Little things like expressing gratitude for their time when it's appropriate, when you're in the end of the day, when they're dead beat, they've given the report. Thank you so much for your time. Thank you for your mentorship. Little things like this. Thank you. You taught me how to respond to difficult situations when you were just going from patient to patient to patient. You were determined to do the best you could and still provide quality care. Thank you. That little bit of gratitude, that emotional intelligence. What is that person feeling? They've gone through a lot. They feel like they're shorting their patients because they're not in there as much, and it's a hard thing for them. So that emotional intelligence means, hey, I'm going to show them gratitude. I'm going to show them grace. Yeah, I'm not going to be able to ask them a ton of questions today, but I'm going to show them grace. I'm going to give them the chance to breathe and let them know that they're still showing you things even without discussing x-rays or labs or therapies or anything like that. Reflection is a key component. This is one of my favorite parts of medicine, is reflecting on the things that you have learned. And this is so valuable. You will thank yourself so much for reflecting at the end of your day, at the end of your shift, what you have learned. If you did this in class, Good for you, and you probably got a lot out of it. Continue that here. Continue it in the clinical realm, and don't just do it while you're at clinicals as a student, but do it as you are a practicing therapist as well. So reflect. It's very easy to internalize the lessons that you're learning during the rotations, but after each shift, reflect on your interactions with your preceptors. How did it go today, right? Be honest with yourself. How did it go today with my preceptor? How did it go today with the patients I got to meet? How did it go with the other team members, the other people in the hospital, the techs, the X-ray techs that were taking X-ray pictures, or the MRI techs, or the labs people, or the nursing staff, right? How did it go? Reflect on that. Are there areas that I need to grow in there? One of the things that I always like is writing a reflective journal. I would write down, what did I learn today? How did I learn? What are things I need to work on? And this allows you to assess your performance and really identify areas that you want to grow in. The other thing too, when you're doing this, is you can celebrate your success too. Hey, I got a blood gas for the first time. Hey, I got to intubate for the first time. Hey, I got to do this. I got to meet someone. I got to do CPR for the first time on someone. Celebrate those little successes as well in there in your reflection. Don't just make it about negative things and, oh, I wish I could have done better here. I wish I could have done better here. Also, put the moments that were great. Put the moments of success in there, whether it's academic, whether it's emotional success, whatever it is. Put those moments of success in there. This self-assessment process really helps you prepare for your future with preceptors, and really enables you to approach learning with a greater confidence and focus, because you know that you're working on these individual areas. You know how you're doing in these areas, so that way you can grow and be a better therapist as you're going through this process, not only while you're in school, but also outside of school. All right, so the boring slide here, but in summary here, I mean, engaging appropriately with your clinical preceptors is a big component of your healthcare education. Effective communication, being professional, being willing to learn. You can really foster a lot of good relationships and positive relationships with preceptors by following these little tips. These little tips will enhance your clinical experience. They will see you as being different, someone that asks questions, someone that's willing to learn, someone that's willing to grow, someone that is a professional and they're working on being a professional already. So seeking feedback, asking thoughtful questions, and being active in discussions, you're going to demonstrate your commitment to learning and also to the profession, so that way they see you as that valuable member of their team. They can see you working with them. So ultimately, your interactions will prepare you for your future role as a compassionate healthcare provider. And so I want you to start thinking about how you're going to interact and using these tips. And that's all I have for now. Thanks for listening.